Hello, everyone. My name is Kaye. I'm a nurse practitioner, so just to give you a bit of a background about myself, I am I work at the Barlow Center. I have my family nurse practitioner degree. I'm an acute geriatric acute care nurse practitioner, and I have my doctorates. And I am so happy to be here today to talk to you about how we can keep our brain feeling nice and young. Before we get started, I actually just want to share a story with you. So every Friday night, I go to these dinners and I see familiar faces time to time. And sometimes I feel that I can't remember, some names. And I ask myself, is this normal? Am I not, are they just not important to me? Am I just not being mindful of their names? Can anyone relate? Okay, well, this is normal. And before we go forward, if anyone has any questions, you can feel free to put it in the chat or just wait to the end of the presentation. Okay, now we'll get started. So we'll get started today by talking about what we're going to talk about. So first, we'll begin with Alzheimer's disease, facts and figures. We'll then go into healthy brain aging. We'll talk about dementia and Alzheimer's. Risk factors, age, race, sleep, vascular health, preventive measures, and available resources. Okay. So first to get started with some numbers and statistics. So there are about 6 million Americans today living with Alzheimer's disease, and this number is projected to increase by 13 million by the year 2050. And that's pretty staggering. And the reason for that is because we have an aging population, especially the baby boomer population. And in this field, we actually have a shortage of neurologists. We don't have enough neurologists in the different dimensions, different divisions of neurology and dementia care. And just to think back to COVID, during that time, Alzheimer's disease was the 7th leading cause of death, where heart disease, diabetes, kidney disease, that was all decreasing at that time. But with Alzheimer's disease, that actually increased about 140% during that time. And now it's the 5th leading cause of death in the United States, which is pretty staggering. Now, people who are Medicare beneficiaries, Alzheimer's disease costs twice as much than any type of other condition. And for those who have Medicaid, it triples the amount. So again, there's billions of care that goes on with Alzheimer's disease. And most of the people taking care of this population are families, there's unpaid caregivers, and the projected amount of cost in this field is it's going to come down to nearly 1 trillion by the year 2050. Okay, so now let's talk numbers. So age is a risk for Alzheimer's disease, and it doesn't mean it causes Alzheimer's, but it's a big risk. And after the age of 65, the risk doubles for about every 5 years. And after the age of 85, that risk actually doubles nearly to 1/3. So you can see that there is a steep incline after the age of 85. Now, on the right side, you can see that women are disproportionately at a higher risk than men. And there's many reasons for this. So first of all, women actually they live longer than men. That's one. Number two, biologically, women are different. After menopause, there are changes in the brain, and we know that estrogen plays a big role in protective measures in brain health for women. And number three, on our X chromosome, having the APOE4, that's a risk factor. And as women, we have a better immune system than men, and there's research out there that the immune response in Alzheimer's can cause more an inflammatory cascade. Okay, so before we can go forward, we have to talk about how the brain works. So in the brain, we have billions of neurons, and we have something called these uh, synapses. And in the brain, the synapses secrete neurotransmitters called acetylcholine, and that is what essentially makes your brain work and communicate with all these different neurons. Now, we have gray matter and white matter. The gray matter is on the outside of the brain. And if you think of this like a computer, you get an input. And the input goes into the white matter, which processes, condenses the information, and gives you an output. Just like how a computer works, the brain is essentially the same way. So think of the brain as a computer. You have all these networks in the brain going all these neurons that are communicating very fast to do everything that you want to do, from speaking to writing, expressing yourself, problem solving. So we have to give our brain some more credit. Okay. So what is healthy brain aging? So just like our body ages, our brain ages. And after age 40, our brain loses volume, and that's normal, about 5%. And then after the age 70, it's a little bit more than that. But that's normal. Now, with healthy brain aging, we can see that you might be a little bit more slower to finish tasks. You might have some word finding difficulty, some things from here and there. The flexibility of our cognition from going from one task to another might be a bit decreased. But optimally, as you age, as your brain ages healthily, you're able to function independently. You're still able to be very productive. Again, things might be a little slower, but you're able to continue to live your life. Okay, so you're all probably wondering, what is dementia? What is Alzheimer's? It's not synonymous terms. Dementia is a group of symptoms for cognitive impairment, whether it's speech difficulty, memory issues, planning, problem solving. And dementia falls under an umbrella where there's different pathologies in the brain that can cause dementia. So Alzheimer's disease, which is the most common form of dementia, 60 to 80% of cases. And then we have Lewy body dementia, vascular dementia, frontal temporal dementia, and then others, Parkinson's and Huntington's. And again, these are all different pathologies that cause changes in the brain that causes you to have speech, language, difficulty problem solving, personality changes, things like that. And just to kind of briefly go over some of these conditions, like Lewy body dementia, some of the first symptoms that you may see is some visual spatial sleep disturbance, like hiccing or hitting in your sleep. There could be some motor issues like Parkinsonian type features where there's slower movements. And Lewy body dementia is about 5 to 10% of cases. Vascular dementia is also about 5 to 10% of cases, and this is damage to the blood vessels in the brain from long-standing high blood pressure, high cholesterol that can damage the neurons over time. And with this, you can essentially see difficulty with processing, problem solving, things that might take a little slower to do things, and then essentially memory problems. But you can also see some slower movements and motor abilities. And then frontal temporal dementia is 5 to 10% of cases. And with this, there might be some personality changes in the frontal lobes, and then some speech or difficulty understanding a language, which could happen. Usually memory it could come later, but that's not one of the first symptoms of this condition. And then a lot of these cases, more than 50% of cases actually have a mixed etiology, meaning you can have Lewy body dementia, Lewy body with Alzheimer's. You can see vascular with Lewy body. And depending on what part of the brain is affected, you can have different pathology. So sometimes it gets a little bit more difficult when there's more brain affected, since a lot of these conditions, they overlap with one another. Okay, so then there's different phases of Alzheimer's disease. Okay, so essentially preclinical, there's a whole continuum of this. So with preclinical Alzheimer's disease, there might be biological changes on imaging, but you're not presenting with any signs or symptoms. Changes in the brain, just like having high cholesterol. I'm sorry, having high blood sugars doesn't necessarily mean you have diabetes, but there's changes biologically. And then over time, this can turn into mild cognitive impairment. And mild cognitive impairment is when you notice that there's subtle changes in your memory. Family might not notice anything, but you're noticing that you might have some more difficulty processing or finding your words. But you're still able to function independently on a daily basis, and it's not interfering with your everyday activities. And then we have mild dementia. And at this stage, you can still go about your day and be independent, but you might need some help to maximize that independence. And some of the first signs in this stage could be difficulty with higher cognitive abilities, which is handling finances, difficulty with planning and processing those finances. But again, you're still able to function independently on a daily basis. Then we move on to moderate stage. And again, with all these stages, the time frame varies from person to person. Moderate stage is when there's confusion, when now you need assistance in your daily functioning to help optimize your independence. And in this stage, there might be more difficulty doing multitask things. So this can be from, difficulty dressing, going to the closet and being able to pick out what you're going to wear, or even bathing. And this is usually the longest stage, and it will interfere with many activities of daily living. And then there's the severe stage of dementia. And at this stage, usually there is a need for around-the-clock care. There can be loss of mobility where you need more assistance on a day-to-day getting around to places. There could be speech difficulty, some swallowing issues. And at this stage, there's a higher risk of hospitalization due to lack of mobility, staying in place, UTIs, pneumonia. Okay. All right. And then we move on to medical problems that can mimic dementia. That doesn't necessarily mean that there is a disease in the brain going on. So there's something called polypharmacy. There's many medications that can mimic and cause cognitive impairment, slower thinking and processing. And some of these medications could be sleep aids. Sleep aids are known, like Ambien, to cause some issues with cognition. And then there's anticholinergics, like medications for the bladder, that can interfere with someone's cognitive function. And then there's opioids. And again, these medications can cause some issues. And then there's thyroid. So when the thyroid is the energy for every body system in the body. And if your thyroid is low, you might think a little slower. You might not be able to remember things. So it's the energy source for every process in the body. So making sure that your thyroid function is within normal range. And then we have hearing, and this goes unnoticed, but having hearing difficulty, you can't process, you can't understand, can't listen. And you're compensating by using other brain centers. So having your hearing checked is actually really important because over time, this can lead to dementia. It's one of the biggest risk factors, actually. And then alcohol. Alcohol is toxic to every cell in the body. So not drinking as much as the recommendations. And then dehydration. Dehydration, it's 70% of our volume. So again, as we get older, you lose that thirst mechanism. So it's really important to be hydrating throughout the day because that can lead to difficulty processing and understanding and remembering from day to day. And then infections. Infections have a direct link to the brain, and especially UTIs. You can have something called an acute delirium where you just are confused. So just as women and men, just being more cautious of hygiene is really important from day to day. And then there's depression, being alone. Being alone, as human beings, we're meant to be connected to other people. So being alone, leads to sleeping more, leads to overeating, leads to, not great behavior. So that can also mimic dementia because you're not functioning and stimulating your brain. Okay. Okay, so now let's talk about Alzheimer's disease. What is Alzheimer's disease? So Alzheimer's disease is when there's a buildup of amyloid in the brain. The amyloid is what essentially blocks the connection between the neurons, right? And then as that happens, you have something called a tau protein. A tau protein, it blocks the nutrients inside the cells. So if the nutrients, if the neurons can't get the oxygen and nutrients they need, they essentially die, and that is what causes the neurodegeneration. Okay. Okay, so Alzheimer's disease is a progressive disease, and people can live for many, many years. And there's many factors. So depending on the age of onset, that can affect the time of someone progressing throughout their disease. People can live, it says at the time of onset, people live up to 8 years, but we can see people living up to 20 years. So it varies from person to person and for many different variables. Okay. So what is normal brain, what is healthy brain aging? What's normal? So it's normal to be forgetful. Sometimes people have difficulty learned information, but if you're able to remember that later in the day, then that's considered normal. However, if you're needing more time to write things down using other device aids, then that is typically not normal and should be checked out. And then there's some issues if there's issues with problem solving, following a recipe, following your bills, your financial bills from month to month. Sometimes it's normal to forget, but if that becomes consistent, that's not normal. And then if there's confusion with time and place, sometimes it's normal to forget what day of the week it is, the dates, but when you miss dates, times, big events that has happened in the past, that is a bit concerning. And then trouble understanding visual images, your time and space, especially with driving. Noticed if you went past a red light or going through a stop sign, like having those judgment issues could be a problem. Normal part of aging is, maybe you're having difficulty seeing due to cataracts. So there are some red flags here. And then misplacing items. We all misplace items time to time, but putting things in places that they don't belong, like putting the chicken in the cabinet, that's not normal. And then also, having decreased, or poor judgment in your day-to-day with hygiene or Again, money, making bad decisions. And then when you're in a conversation talking to other people, if you find yourself, kind of becoming more socially isolated because you have difficulty finding your words or getting your words out, that is a sign of concern. But again, from time to time, it's normal to forget what word you're going to use. That's normal. Okay, so this is not just a one size fits all. There's many variables that contribute to neurodegenerative conditions and keeping our brain unhealthy, right? So we have our genes, we have the choices that we make from day to day, from the day we are born, to our environment, where we live, our zip code. So there's many variables to healthy brain aging. So we all heard of the APOE for the brain. What does that mean? So our brain is made up of fatty acids, right? Triglycerides, phospholipids, and this is all important for plasticity of the brain, for the synapses, for neuronal health. Our brain is made up of fatty acids, so it's super important to be getting that in our diet, and we'll get more into that. So the APOE helps with our lipid metabolism, and the different proteins have different functions, okay? And we get an APOE, one from our mother and one from our father. So there's 6 different copies, 6 different genotypes that you can have for the APOE. Now, APOE4, having a copy of that can increase the risk of vascular disease in the brain. We know that APOE4 risk can increase the stress response injury in the brain. And just because you have a copy of the APOE4 doesn't mean you're going to get Alzheimer's disease. There's something also called the APOE2 that has been studied showing that it has a protective component to it. And we have an APOE3, which has shown in studies to have a neutral effect on the brain. And again, APOE having 1 copy does not necessarily mean that you're going to get Alzheimer's. And even having 2 copies doesn't necessarily mean you'll get Alzheimer's, but it does increase your risk. Okay, so we have risk genes and we have deterministic genes. So the deterministic genes is your genes like preselin and precursor genes that actually cause Alzheimer's. And these cases happen when the age of onset of having dementia-like symptoms is 65 years or younger. And this is less than 1% of the population. Okay, so our risk factors. So like I said prior, this is not just a one size fits all. Everything starts from when you're born to adult life, to midlife, and even going into your late life. So again, having APOE, can increase your risk, but doesn't necessarily cause disease. Education, we know formal education in our 20s plays a huge role in this, because the more formal education that you have, the more resilience, more plasticity you have in your brain, the more the prefrontal cortex is built. We know that physical activity as well, going throughout our lifespan, is super important. It has shown to reduce the risk of cognitive decline and dementia for many reasons. So everything starting in our 20s is super important. Our diet as well, because we are what we eat. Now, things don't happen overnight. It takes years and years. And we see here in midlife, the risk of high blood pressure, obesity, high cholesterol goes up. Part of the reason is we have more stress in our life. There's different biological changes, especially in women, also misusing alcohol and not getting enough sleep, which we'll get into. But there's a transition phase between midlife to late life that can increase the risk if we're not proactive in what we do on a daily basis, again, starting in our 20s. So like I said, everything stems from the day that, we come into the life and who we're surrounded by. We do know that there are risk factors in regards to smoking, and diabetes, that plays a huge role in having poor cognitive health. And, as you go on, it damages the neurons, it damages the nutrient supply to the neurons and the vessels in the brain. And staying cognitively stimulated through doing work, being socially connected, reduces the risk of dementia and all these different neuronal insults to the brain. So there are protective factors that we can do to mitigate the risk. Okay, so we spoke about age, so things that are non-modifiable. We spoke about the age, our genes, family history. We'll get into race. Modifiable risk factors, most of the rest of the presentation will be about diabetes, high blood pressure, depression, obesity, and sleep patterns that really do increase the risk of Alzheimer's disease and other related dementias. Okay, so you might have all have heard about type 3 diabetes of the brain. So to just talk about diabetes itself, it's when you have a lot of sugar in your body, and your cells can't take up the sugar because your liver can't function properly since it keeps on producing and it's not getting a rest. Essentially getting a rest. I'm sorry, it's your pancreas. Excuse me. So yeah, the pancreas is dysfunctional, so it's not able to secrete enough insulin in order for the cells to take up glucose. And just like the body, the brain is affected by this. It has insulin receptors in the brain. So essentially, if the cells in the body can't take up the sugar, then the brain it damages the vessels in the brain, which causes the white matter changes that we see, causing cognitive impairment because we're damaging the neurons. And there have been many studies that this has shown to decrease mitochondria, it causes dysfunction in the brain, decreases blood flow, increases mini strokes in the brain, could decrease intake of glucose metabolism. So just like how diabetes and high blood sugar affects the body, it also crosses the blood-brain barrier, affects it in the same way. Okay, so with diabetes, it comes with lifestyle modifications at first. So it is recommended to have a balanced diet of fruit, vegetables, staying away from refined carbohydrates, and exercising. It's recommended to exercise at least 150 minutes a week with resistance training 2 to 3 times a week. And depending on what the hemoglobin A1C is, anything below 6.5 is okay, but anything above 6.5 is considered diabetes and usually given 2 to 3 months to make some lifestyle modifications. And if that doesn't work, then usually medication is started like metformin. Okay, so it's really important to be checking blood sugars before meals if you do have diabetes or if you're at risk for diabetes, and to exercise at least 150 minutes a week with a balanced diet. Okay, so we talk a lot about the brain. So the heart and the brain are very connected. What's good for the heart is good for the brain. The heart is the direct access to the brain, right? So if you have good vascular health in the heart, you most likely have good vascular health in the brain. Um, and you can see here that when there's damage to the vessels in the heart from coronary artery disease, from plaque, from high blood pressure, high cholesterol, it just doesn't cause, it doesn't just increase the risk for a heart attack, but it also, you can see here on the left side, causes white matter changes in the brain and atrophy, meaning volume loss in the brain, neurodegeneration from the damaging vessels from the risks. So it is recommended to, see the primary care doctor every so often, a cardiologist, to make sure your blood pressure is normal range. And blood pressure ranges, normal range is anything from less than 120 systolic and less than 80 diastolic. And it can vary depending on what condition you have, but that's the optimal goal. And for cholesterol levels, anything below 200 is heart healthy. Anything above that is a bit concerning and recommended to be on cholesterol medication. Okay. And we talk about sleep. So how is sleep linked to poor brain health? So it's okay to, from time to time, to not get adequate rest, right? But this might lead to difficulty concentrating during the day, decline in the mood, impaired memory, difficulty processing and consolidating memories. But we do know long-term lack of long-term sleep deprivation does increase the risk of Alzheimer's disease, because when you're sleeping, the brain has a recycle mechanism where it removes amyloid and metabolic waste that accumulates in the brain from the day. And that happens during your deeper stages of sleep. And over time, long term, it will cause difficulty with word finding, could cause difficulty with language, your work performance. Um, Anything that you are able to do from a day-to-day, inadequate sleep will cause long-term problems from removing plaque in the brain that builds up from the day. So what are causes of poor sleep? It's recommended causes before, what are causes of poor sleep? Some of it is using bright light before bed, meaning using your computer, using the cell phone before bed. It's not recommended for at least 2 hours. Your brain needs to get the signal to secrete melatonin from the brain to get that signal to fall asleep. So if you have bright light before bed, you're most likely not going to be able to fall asleep. And if you do fall asleep, you're probably not going into a deep enough sleep to feel well rested next day. It's recommended not to eat at least 2 hours before bedtime, because you want the blood to go to your brain, not your stomach, to go into complete rest. And reducing caffeine. Caffeine has a direct link to the brain, which will also affect your sleep. No matter how much caffeine that you drink, caffeine does affect sleep, especially the deeper stages of sleep if it's taken in the evening time or any time after 5. And we do know that, stress and lack of physical activity, can cause poor sleep. There's been stages in that, and hormonal changes, especially for women, it could be more difficulty to fall asleep due to menopause. So finding a good sleep routine is really super important in order to reduce the risk of Alzheimer's disease. And then we have sleep apnea, and this goes untreated sometimes. And some risks for sleep apnea, if you find yourself, if any witness snoring, or waking up with headaches, feeling very fatigued or tired throughout the day, if you have an irritable mood, dry mouth when you wake up in the morning, these are signs that it could be sleep apnea. So it's highly recommended to see a sleep specialist because this does not just increase your risk for dementia, but it also increases your risk for heart disease and metabolic disorders. Uh, because essentially it's reducing the oxygen to your brain and the rest of your body, which is not great. So it's super important to have this treated. Okay, so what do we know about diet and the prevention of Alzheimer's disease? So there have been many studies that have been done to show that a Mediterranean diet can reduce your risk of cognitive decline and dementia. Foods that are anti-inflammatory and reduce oxidative stress, like fatty fish, like salmon, cod, there's chicken, eggs. It's highly recommended to have these in the diet and to reduce your intake of refined carbohydrates like desserts, essentially anything that tastes good is essentially not so good for you. So it has been recommended as a Mediterranean diet, more so the MIND diet, to stick to in order to reduce the risk. So this also maintains to having berries at least twice a week, 1 ounce serving of nuts, poultry at least twice a week, and kind of reducing your intake of cheese and margarine. Okay, and again, if anyone wants to read more about the MIND diet, there have been studies in the New England Journal of Medicine in regards to reducing the risk of cognitive decline and dementia to optimize your brain function. Okay, so we hear a lot about vitamins and supplements. I'm sure a lot of you have heard about Prevagen. So there have been no clinical studies to prove that Prevagen or any supplement prevents Alzheimer's disease. Now, if you're not getting enough, fish oil or, B complex in your diet, vitamin D, then yeah, it's recommended to take a multivitamin supplement. And as you get older, if your GI system might not be as effective or might not absorb nutrients efficiently as once before, so having low vitamin B levels, can cause some cognitive impairment because your neurons are essentially made up of B vitamins and folate and fatty acids. So it is recommended as well to have your blood work checked to make sure that your vitamins are within range. It's best to get these nutrients through your diet, right? They're high in avocado, many leafy greens, papaya, kidney beans, banana, nuts. So in regards to vitamins and supplements, it's definitely recommended to get it through your food instead of through a supplement, but if needed, a multivitamin is recommended. Okay, so can exercise shape your brain? Yes, it can. There have been many studies to show that cardiovascular exercise, 30 to 40 minutes, about 5 times a week, can reduce your risk of dementia and cognitive decline because when you exercise, you secrete all these different proteins like BDNF, you secrete lactate, irisin, that can increase the volume of your hippocampus. It increases neuroplasticity, the immune function of the brain, and it upregulates your processing, your learning, and all these different neurotransmitters that help with attention and problem solving. So it's highly recommended. And again, there has been clinical studies to show that exercise is proven to slow down or reduce your risk of cognitive decline. Okay. So how can feeling lonely or isolated affect your brain? So as humans, we are meant to be socially connected with other people. And when you're isolated, that leads to depression, and depression leads to risky behavior like eating unhealthy foods, either sleeping too much, sleeping too little, and not being able to process. So if you think back to the time where you were feeling lonely and then you went to go hang out with your friends or your family, you can see a difference in in your brain function in regards to feeling more efficient and uh, active in your day to day. And it has shown to show that being lonely can increase your risk for stroke and cardiovascular disease and early death. So it's really important to have a sense of connection and be around people, because being lonely leads to depression. There have been brain changes and studies showing that depression can increase the risk of dementia and other cognitive decline. So having a meaning for a healthy life, a healthy brain is super important. So thinking about, cost of living, where you live, your zip code, the people that you're surrounded by, the community that you live in, being around local libraries and participating in programs and groups and having hobbies, something that keeps you connected on a day-to-day basis, because we do know the more that the brain is activated and stimulated, the better off you'll be than sitting at home and watching TV and not doing much, because the brain is essentially a muscle. If you don't use it, you lose it. And there's different mechanisms to brain function, from social connections, living and being safe and secure and having these close connections. Okay, so there are health disparities that are driven by social and economic inequalities. So research suggests that these factors of life expectancy are a bit complex and multifactorial. And this includes, having health insurance coverage, access to care, there's social and economic factors, health and behaviors that are rooted in our structural and systemic racism and discrimination. So the disparities of income, employment, our zip code, again, the education, the food around us, can dictate, our health, and how we live and age. Okay. So race and Alzheimer's disease. So white Caucasians make up majority of the 5 million people in the United States with Alzheimer's. But there have been evidence showing that African Americans and Hispanics are definitely at a higher risk, and not because of the APOE4, but because of they're at higher risk for diabetes, high blood pressure, high cholesterol, that can increase their risk for Alzheimer's and other dementias. It has shown that African Americans are 2 times than white Caucasians to have dementia, and Hispanics are about 1.5 times at an increased risk, more than whites, to have dementia. And we do know that African Americans and Hispanics, they seek care later when their disease is more advanced. So their cost in the healthcare system might be a lot higher than someone coming in at the early stages. Okay. So we spoke a lot about bad diet, eating, depression, loneliness, bad sleep, and again, this is not a one size fits all. So super important to stay engaged, have a healthy diet, exercise, have a meaning of life, sleeping regularly, not fragmented, and having a purpose every day, to lead to a healthier brain. And when we're able to balance all of these out, we can reduce the risk of Alzheimer's and other related dementias. And with that said, this is the end of the presentation. And if anyone has any questions, I'd be more than happy to answer.